Hi, this is Michael Ruscio, and let's discuss 4 signs that you could have a gut issue present. This is important because there are many symptoms that are not digestive in nature that are actually caused by what's going on in your gut. The reason why gut health is so important is maybe obvious, but worth restating. This is where your nutrient and caloric absorption occurs. And not as commonly appreciated, this may be the main source of inflammation in the body because you have the highest density of immune cells in your entire body, in your small intestine, as this selectively permeable membrane lets certain things in and polices with inflammation and the immune system out other things that we don't want in your body. So, what are the symptoms? Well, the first involves mood. We can look at a systematic review of 73 papers. So, this is a very high quality data point. And they found that in those with IBS typically consists of abdominal pain or discomfort, along with altered bowel function. 39% of IBS patients have anxiety, and 30% have depression. So a fairly large connection between having some fairly common digestive symptoms, as in IBS, and having anxiety or depression. Now, this also broadens out a bit to a wider category of digestive symptomology known as FGDs, or functional gastrointestinal disorders. And it has also been shown that even with other symptoms like constipation, dyspepsia, reflux, there is a correlation to imbalances in mood. So it's important to keep in mind that there is this connection between your gut and your mood. How? What is it that's going on that is allowing the GI to impact things like anxiety and depression? Well, we can turn to another meta-analysis, this time appearing in the journal Nature, to better understand the gut-brain connection, and specifically how gut bacteria can translocate and get into the brain and cause inflammation and therefore perturbations in your mood. And what you're seeing here is a nice schematic from that meta-analysis in Nature, wherein you're looking at a healthy intestinal lining on the one side, and then as I've demarcated in red, leaky gut or permeability between these, what are known as tight junctions, which should not allow food through or should only selectively allow particles through. In leaky gut, there is a separation of these tight junctions. And then, as I've also checked off for you with the red marks, this leads to inflammation and bacterial translocation. And to quote the journal, elevated levels of gut dysbiosis positively correlate with severity of sickness behavior, things like depression, anxiety, with severe mental illness and chronic fatigue. Now, I don't like the term severe mental illness. I would pardon that. We are quoting directly from a medical journal. They were looking at some conditions in this paper, it being a meta-analysis, that one may term more severe. I believe schizophrenia was also included in this. The higher level observation I'd like you to take away is there is this connection between what's going on in your gut and your mood. Another review paper from the Journal of Neuropharmacology, to quote, a growing body of evidence suggests that a significant proportion of patients with mood disorders exhibit a chronic low-grade inflammation, as we saw in that same schematic. And even further yet still, if we inject individuals with LPS, lipopolysaccharides, bacterial fragments that essentially in leaky gut can translocate, this injection leads to depressive symptoms in otherwise healthy adults. And finally here, a 2020 review paper maps out this causal web, if you will, between gastrointestinal symptoms, oxidative stress, inflammation, and psychiatric comorbidities or symptoms. So very important to keep in mind that if you're experiencing the unpleasant symptom of anxiety or, let's say, depression, look to your gut as a potential cause. I also want to be careful to say, knowing that this cohort of individuals is more prone toward anxiety, there is a lot that can be done to resolve this. So let's look at these mechanisms as steps toward empowerment and not as something to lead to fear or even further anxiety. There's a lot that can be done. I want to first get you to the understanding that what is happening mood-wise may actually be attributed to what's going on in the gut, and then we can focus our attention on that. It does not also, as a quick aside, require expensive testing, highly restrictive diets, or heavy-handed supplement recommendations. We've discussed in many other locations what can be done to optimize gut health. And again, good news there. There are some simple solutions that can really deliver, especially as it pertains to mood. I'm curious, what's your experience? Have you noticed, as maybe some other people watching this have, that as your gut goes, your mood goes? Let me know in the comments below. Cognition. It's been shown that certain food triggers, namely gluten, may propagate brain fog. So a 2020 pilot study published in PLOS ONE looked at 125 non-celiac gluten-sensitive patients. Now, this could be a biased sample because it is looking at a cohort that has self-reported a problem with gluten, but nonetheless, I think this schematic or this data table is worth looking at. And they found a decent distribution of fatigue and of brain fog in those who have noted non-celiac gluten sensitivity. I should be careful to say that on the one hand, we do want to pay attention to food triggers that may propagate symptoms. But specifically with gluten, it's really been poorly handled, the messaging, in terms of giving people a percentage of risk associated with the vague recommendation, be careful with gluten. Gluten could be a problem. Now, estimates here vary, but they vary from roughly 0.3% to perhaps as high as about 10 to 13% of the population, at the most generous. What we should take away from this is, yes, gluten can be a problem for some, but it is certainly not a problem for all. The best data here do not even show nearly half of the population, so we should bear this in mind. We should also bear in mind and appreciate that it may not be the gluten for all people. It may be what accompanies gluten, this other compound known as FODMAPs. And what's good about this is FODMAP tolerance can improve with time, as can dairy tolerance, and I would also argue as can gluten tolerance. Be on the lookout for this, because nocebo, which is a negative expectation, it's the inverse of the placebo, a positive expectation, is a real thing. And if you've read many blogs or listened to lectures about all the ills of gluten, that can lead you to expect a negative reaction. However, you may not need to adhere to that dietary restriction. So revisit an introduction periodically and objectively. So yes, eliminate, but then at some point reintroduce and make sure you objectively qualify if you have a problem with gluten and you should avoid it. Again, the stats are in your favor that you won't need to. Another debate is whether or not grains are a health food, and I'll leave that debate for the moment. But so as to empower you with the broadest possible diet, even if it's the occasional slice of pizza, I want you to have that flexibility. And again, not avoid food solely based upon faith or fear. Energy and fatigue. 54% of IBS patients experience fatigue. An additional meta-analysis, this time of 24 studies, synthesized 7 studies into a meta-analysis. And what they found was significantly higher levels of TNF-alpha in IBS patients compared to healthy controls, as well as a positive correlation between TNF-alpha, an inflammatory cytokine, and fatigue. Now, this comes from a study in the Journal of Brain, Behavior, and Immunology, and important to bear in mind that there is this connection between the gut, inflammation, and fatigue. So again, if you're finding that you're needing a lot of espresso or coffee or energy drinks throughout the day, and you have any digestive symptoms, do not discount those. Those may be the source of your fatigue. And again, there's a lot that can be done to improve your gut health and therefore improve not only your fatigue, but also your cognition and your mood. While we're on this topic, we should touch on cortisol and be careful of this pitfall of trying to shoehorn yourself into the cortisol hypothesis. We can find data, as this study indicates, that shows that healthy controls have higher cortisol levels, and those with IBS and Crohn's disease have progressively lower cortisol levels. However, this would be an example of cherry picking, because if we look at other studies, like a meta-analysis of 85 studies, they did not find a correlation between cortisol levels and IBS. Important to note that some studies have found no correlation. Some have found that people with IBS have elevated cortisol, and some have found dysregulation of cortisol. So the takeaway from this is that when we look at all the data and we don't just cherry pick, cortisol does not seem to be the cause of the problem. So be careful not to chase lab markers and to address the root cause. And I make this caution because I want to save you from serial cortisol or adrenal tests that take up time and money and really are not needed. And finally here, the fourth sign that there could be a gut issue present are skin issues. A 2019 review from the Journal of Clinical Medicine quoted, "Leaky gut in eczema patients causes skin inflammation by enabling the penetration of toxins and poorly digested food and microbes into systemic circulation." So essentially, leaky gut can lead to particles not only getting to your brain, but getting to your skin and causing skin reactions. There's an old saying in naturopathic medicine that the skin is a reflection of the gut. Now, as a follow-up here, is this just academic, or are there any interventional data showing that treatment of the gut can then improve the skin condition? Well, there is a randomized control trial from the Journal of Clinical Gastroenterology and Hepatology, and to quote, "This study demonstrates that rosacea patients have a significantly higher SIBO prevalence than controls." Rosacea is essentially reddening of the skin. Moreover, eradication of SIBO induced an almost complete regression of their cutaneous or skin lesions and maintained this excellent result for at least 9 months. So very exciting data point here showing not only is there a connection, because it's one thing to show correlation, but if we have treatment data, then we're really showing to some extent causality. And that's what this SIBO and rosacea study is documenting. So zooming way out, in recap, 4 of the signs that you could have a gut issue present are mood imbalances, cognitive challenges, fatigue, and skin issues. Why? Because the gut connects to the brain, to the skin, via toxins, via immune system, and also as it connects to the brain, likely also impacts your fatigue. There are simple supports. An elimination diet is a great place to start, as are probiotics. We've discussed in many other video things you can do to improve your gut health. I'll leave those resources for you for more, but I want to close with empowerment. Do not take this information the wrong way. This is meant for you to now direct your focus at reasonable and practical interventions for your gut health. Avoid the zealotry, avoid the extreme dieting, avoid the expensive lab tests. Simple supports, dietarily and supplementally, that have been shown through randomized controlled trials are the best and the most practical and the most cost-effective path. And again, we have a lot of resources for you there. This is Michael Ruscio, and I really hope this helps you with a number of symptoms that I had and allows you to improve your gut health and therefore have better mood, better cognition, healthier looking skin, and better energy.